Okay, so I have reviewed the physician's order for my abdominal wound care dressing, and that is for my patient Mortuary Fin 999-888-777, and I've entered the room, gathered all my supplies, and made sure the overbed table was clean, and I've washed my hands. So I will now compare the patient wristband to my MAR, and it is Mortuary Fin 999-888-888-777-777. Hello sir, my name is Hong Yang Lin. I'm a student nurse. Can you please tell me your first name, last name, date of birth, and if you have any allergies? Great, thank you. The reason I'm here is because I am doing an abdominal wound care dressing change on you, and that includes removing the old Mefix, removing the old dressing, removing the old roller Curlex, and assessing the abdominal incision tissue and assessing the healing, assessing the dimensions, and irrigating the clean and putting on new packing and new 4x4s and new Mefix. Is this all okay with you? Great. And before we get started, would you like your PRN pain medication, Analgesia? Yes, you do? Okay, great. I have administered to you your PRN medications, and I will now wash my hands and set up my sterile field. And the next thing I'm going to add is my 2x2s and my 4x4s. Now I'm going to add in my 30cc syringe followed by my 20 gauge IV Cathlon. Now what I'm going to add in is my sterile scissors followed by my cotton tipped applicators. Now what I add in is my roller Curlex and my normal saline. I perform my hand hygiene and I put on my clean gloves in order to remove the old dressing. On the old Me-Fix as well as on the old 4x4s, there is reddish pink serosanguinous drainage and it has a small amount of odor to it. On the old roller Curlex, there is also reddish pink serosanguinous drainage. There's just a small amount and it has a small amount of odor to it. I perform hand hygiene and I make room for myself to don sterile gloves. I have at least 10 cc's of normal saline, and in real clinical settings I would irrigate until it runs clear. I am irrigating from top to bottom, only the incision. I think I may need a little bit more. And that will allow me to do the last portion at the very bottom. And I only irrigate the inside and avoid touching the peri-wound skin. I have used much more than 10 cc's. I will now fold 4x4s and using a sterile no-touch technique so that my sterile hands remain sterile, I will dry the very inside. There's still a little bit left. In the very middle portion. So my hands are still sterile because they did not touch the wound. Using 2x2s formed into rosettes, I will be wiping the peri-wound skin with normal saline soaked 2x2s. First I wipe the left side, one swipe from top to bottom and discard of it. Another rosette for the right side. Discard, and now I dry the left and right peri-wound skin using dry 2x2 rosettes. In a real clinical setting, I would clean the peri-wound until it is truly cleaned. So I just did the left side, now I will do the right side. For assessment of the wound, just by looking at it, it looks to be reddish pink granulation tissue, and the abdominal incision is healing by secondary intention. Peri-wound skin is dry and intact. I will measure the dimensions. A length of 14 centimeters. A width of 4 centimeters. And a depth of 3 centimeters. Now what I will do is I will go around the circumference and I will see if I see any undermining or tunneling. No tunneling or undermining is noted. Using my roller Curlex, I will soak it in normal saline. And then wring out excess moisture. and I am packing so that my cotton tipped applicator is only in direct contact with the roller Curlex. I pack to fill all the edges. That was near miss because that roller Curlex touched a small amount of the peri-wound skin, and in real clinical practice I would try to minimize that as much as possible. Now that all the edges are filled, I cut off the excess with my sterile scissors. My hands are still sterile, and I'm going to use that to cover the top of the wound with 2 of these 4x4s. And now my hands no longer need to be sterile. I am allowed to remove my sterile gloves, wash my hands, and now I will put on an abdominal pad followed by Meefix. This was the wrong way. I would have removed the abdominal pad from its sterile package. And the final step is to apply the Meefix. I would clean up all my things, lower the patient's bed, make sure his call bell's within reach, do my exit safety check, and I will document all the dimensions and findings about this wound on the wound care flow sheet as well as the IPN.